How dangerous is vaping? What should you do if you find out your kid vapes? How does vaping affect your teen's health? All that and more on this episode of Because They're Kids. Welcome back to Because They're Kids, the podcast that's built just for kids and their parents. I'm your host, Ann Baum, mom of two and president of Lehigh Valley Riley Children's Hospital, and I'm excited for another episode of our podcast. Teen vaping is a concern for parents. That's why it's important to understand all the health risks of vaping and how to navigate having this conversation with your kid to help keep them safe and healthy. Here to help us talk about the dangers of vaping is my guest, Kristen Hoban, manager of the Weller Health Education and Foundational Career Programming with Lehigh Valley Riley Children's Hospital.
Thank you for having me, Ann.
We're so glad you're here, Kristen, and you have a wealth of knowledge from the Weller Health Center. Tell us more about what Weller does and your role with the organization.
Sure. So Weller Health Education has been around for many, many years. We've been with Lehigh Valley Health Network for since 2017. And I've been with them as the manager since that time. And I manage a team of health educators who are all public health professionals who develop the curriculums and present the programs in the schools. We present to K through 12. We do also community events. We do programs for parents. We're just really trying to speak to parents and educators and definitely the kids about all the different health topics that affect their health. And vaping is definitely one of them.
Thank you for that. I love how Weller finds the topics that are affecting kids and develops the curriculum and then brings it out to kids. They don't have to go looking for it, and it really makes a difference here in our community. So thank you.
Yeah, absolutely.
For all of that.
Yeah, it's a great program.
So our topic today is vaping. We hear a lot about it, but I'm not sure everybody knows a lot about it. So tell us, what is it?
Sure. So vaping is another word for e-cigarettes. And how that name came to be was when you use an e-cigarette, it gives off a very big cloud, a vapor cloud. And so that's how it just got that nickname, basically. And so what a e-cigarette or a vape device actually is, and there are lots of different kinds, but they all work exactly the same. They're all powered by a lithium battery that heats up a coil, which heats up the atomizer and then makes the e-juice or e-liquid, they call it so many different things, turn into an aerosol. So what that is not actually vapor, it's actually an aerosol. And so, along with that comes, so many different chemicals and nicotine and there's just so many different types, and but again, they all work the same.
So interesting, because vaping is perceived to be safer than smoking. Tell us a little bit more about that.
Yeah, and that kind of comes back to that nickname of a vapor, that this misconception that big cloud is water vapor, and it is not. As I said, it's an aerosol. And so the biggest concern with that is these e-liquids. So whether it is a vape device that's disposable, where you're not refilling it, or it's a refillable one, like I said, there's so many types out there. They all contain this liquid, and there are lots of different flavors. And the chemicals that are used to make those liquids are just endless. There's thousands and thousands of flavors. And so what the real danger is, aside from the nicotine, obviously, is the heating of those chemicals. It changes them. This is chemistry, right? When we're talking to the kids, we explain that to them, that the chemicals, when heated to the temperature that they have to be heated to become an aerosol, they change. Just like, there is a chemical reaction, and they can change, and, you're putting this into your body, and it's very dangerous for sure.
So it's possibly more dangerous than smoking, depending on what chemicals someone is putting in to their device.
Right. And it can be, and we always say to the kids this as well, we refer to them as the guinea pig generation, right? So with cigarettes, we know we've had thousands, literally hundreds of, patients and, hundreds of years where we have evidence of tobacco use and the effects on the body. We don't have that with vaping. So yes, we know about nicotine. We know the effects of nicotine on the brain, on the young brain, the developing brain. But what we will not know until many years down the line is the long-term effects of these chemicals.
Right.
And so we tell the kids that. We say, we don't know because just that's how science works, because you need time to find out what those long-term effects will be. So while we do know some of the effects based on the fact that nicotine is, in these liquids, we won't know the true long-term effects of all those chemicals.
Sure. And when you're a kid, long-term effects is probably something that doesn't have a lot of immediate relevance.
Absolutely.
To them. What are some of the other myths that exist for vaping that continue to keep these kids using?
Yeah. So the big one is that it's water vapor and that it's safer than, tobacco smoke. The other one is that they may not contain nicotine. I know, parents definitely, which is great that we're doing this because parents really do need to understand that it is rare to find a vape that does not have nicotine. So that is a myth. And the addiction piece of it is also, I don't know so much of a myth, but something that kids don't fully understand, the addiction to nicotine and how quickly a young brain does become addicted. That's something what we tell the kids as well when we're teaching. We'll say, we do a vaping program for this year. I think we've reached almost 6,000 students.
Great.
Yeah, in the Lehigh Valley area. And we tell them, that this nicotine, like you're so much younger than me. If you and I started vaping together right now, you're going to become addicted quicker than I am because of your young brain. And again, it's not so much a myth, but something that they, like you said, they're young. They're invincible,
Right.
So they're not thinking about that.
So addiction is obviously one of the risks. What are some of the other health risks that go along with vaping?
Yeah. So, your lung tissue is very delicate. It's sensitive. And that very hot aerosol irritates the lung tissue very easily. So you have a lot of, much more bronchitis, asthma, different pulmonary diseases that can be exacerbated by using the vape.
So clearly this is dangerous. What do parents need to know about the various juices and the ingredients so that they can advise their kids and help reinforce what you're teaching them?
Yeah, that's a great question. They need to understand that none of these chemicals are FDA approved in any way. However, there is a little bit of a loophole that they use. So if you go on some of the sites that sell the e-cigarettes and the vapes and the different juices, some of them will say that, these chemicals are, FDA approved. And what I found out through just our own research is that if they say that, they're approved for being ingested in small amounts. They are not approved for heating and inhaling into your lungs. So there is that little deception, right, on the website. So sometimes people will say, no, that is FDA. No, it's not. There's no regulations for that at all. So that you have to be careful of that. And, the other big issue is kids, even younger kids, vaping THC, which is the chemical in marijuana that will get you high, right? So, and the making of that particular e-liquid that goes in the cartridge uses something called a vitamin E acetate, which that has been linked to EVALI, which actually has caused deaths. It's a lung infection, and people have died from that. So, it's dangerous, and they just kind of need to be aware that A lot of these chemicals are not tested, and it's all just coming out as the kids use it, as they get sick. And, it's almost too late at that point.
So as a parent, you really want to protect your kids against this. It sounds really easy to access, appears to be safe. I am sure that kids can get their hands on this pretty easily. How, as a parent, do you protect your kids?
Yeah, so the Pennsylvania did raise the age to buy any vape products from 19 to 21 back, I don't know, maybe 4 or 5 years ago. So that was a step in the right direction. However, kids are still able to get vape products. So there are still plenty of stores that will sell to underage. They just will. And if you think back, I know my generation, we didn't have vapes, we had cigarettes, right? And so where did kids get cigarettes if they wanted to try cigarettes? They got them from their parents. They got them from their older siblings. They had people buy it for them. And it's the same exact thing with vaping. So access is they can get it. If there's a will, there's a way. And there is a pretty steep cost. They can be pricey. And just kind of to talk a little bit about like the different types of vapes and what they cost. So the young kids, the teens, they seem to really want these disposable vapes, and they're not single use. They're just not refillable. Okay. So the way they market them is by puffs. So so you can get, it's 100 puff, or this is a 200 puff, right? And then they're priced accordingly. But for one that's like 100 puffs, it could cost, $12, $15. And I mean, I don't know where the kids get the money for these things, quite frankly. Right. And then if, they have any of these refillable ones, they get very pricey. And it's really an accessory as well. So you can buy, so when people have cell phones, you put like a different case on it and stuff like that as an accessory. Well, you can do the same thing with some of these vapes. You can get like wraps. You could put like your favorite team on it, or your dog or your girlfriend or something. So it's so much bigger than just the actual vaping.
So it's a fashion statement too, or a cool thing.
It's like a culture. It really does. It really is. And so this is an interesting point, because it always amazed me when I first heard it. So there are states that have banned flavored vapes. You can only get like the menthol, right? So there's no flavors. Pennsylvania is not one of them, but maybe someday. And so when I was teaching the students, and I said, there a lot of states are banning the flavored, and I think that'll, really be helpful in reducing the number of young people who are vaping and trying it. Do you agree? And they were like, no. And I was so deflated. I'm like, what do you mean? No. And so we just had a conversation about that. And they were like, well, because they still want to try, it. Like, it's not because it's flavored. Right. And then I went home and I thought to myself, well, back in the day, there were no flavored cigarettes, and we all still wanted to try them. Right. And then when you look at the marketing that these, now it's big tobacco, right? And they have just infinite budgets for marketing, and they market directly to the kids. So again, drawing parallels between cigarettes back, when teens back in like the 80s, to vapes now, cigarettes were never marketed to kids. They were never packaged for kids. If you looked at vapes now, they look like lip gloss or nail polish. They're pretty. The packaging is fruity and it's very, very pretty, very aesthetically pleasing. And they even
attractive
have
to them.
So attractive. And even like they have it like even ones that would appeal more to like guys, right? It'll be like sports cars or really sleek and silver, the packaging. They even have ones that I saw recently. It's the gum with the yellow, the Wrigley's fruit.
Like Juicy Fruit.
Juicy Fruit, thank you.
Yeah.
I couldn't think of it. They have Juicy Fruit vape, and it looks just like that.
Oh my gosh.
Right. So it's just so heavily marketed to kids. They have vapes that look like highlighters. so you can easily hide it.
So it's marketed directly to
Directly.
kids. It's attractive.
Mm-hmm.
It seems safe,
Mm-hmm.
clearly not safe.
Mm-hmm.
As a parent,
Right.
how do you get through to your kids? How do you talk to them about vaping without actually making it seem that forbidden fruit that they want to chase and find?
Exactly. Because the peer pressure is one thing, but then just the curiosity is also huge. So I mean, I'm a parent myself. I have, three boys. And I actually had one of my boys was vaping at one point when he was in high school. And, we obviously, this is what I do for a living, so we had
Right.
talked about this forever and ever, but he, was still so curious. And for me, again, because I'm always, researching and reading about everything having to do with vaping and drugs and stuff, I am always like watching. I'm watching and we keep talking, but he still did it. And so how did I know he did it?
Yeah. How did you find out? Did he tell you or did you catch
absolutely
him?
not. Absolutely not. He's going to tell me. No. Coughing. So
Okay,
much
so
coughing.
that's a sign.
And also the smell. You cannot hide that smell. It's on their clothes. It's in their car. If they're doing it in their room, it's in their room. And it is like, what is that? It's almost like, did I burn a candle? Like, what is that? Like if you're thinking about it, you'll be like, yeah, I have smelled that.
So and that's true even of the fruity ones?
Yeah, you're going to smell it. If they are vaping in their car is going to smell like it. If they're closed, my in the high schools, they have a huge problem, obviously, with vaping in the bathrooms. So a lot of the schools have installed vape monitors. So they'll go off like it's a siren and all that. But before that, there were huge issues. The kids were like, I can't even go in there. I'm going to come out smelling like mangoes because
of the vaping in there. Oh my gosh.
Yeah. So, I mean, for parents with anything with your teenager, it's important to keep those lines of communication open. You yourself, which is so good that we're doing this, you yourself have to be educated. Because I know when we first started doing programs on this in the schools, the teachers were like, oh, I didn't know. Oh, like they didn't know because the kids always know, right?
Right.
But the parents and the adults in their life don't always know.
Yeah, we're late to the party.
We're so late. I know. So, educate yourself. Watch your kid, listen to your kid, let them know that there'll be consequences. I have, as a parent, always had drug tests in my house for nicotine and marijuana because they're going to hide it if they can. And I want to be able to trust my kids, but there is a reality to that, especially if they're driving.
Right.
I need to make sure, like if I have a suspicion, maybe I want to do this test before you go drive.
So let's talk a little bit more about drug testing with your kids. That is hard to do. And they're not going to want to do it. Probably say a lot of things that you don't want to hear. And yet it's an important test for you to conduct, especially if something is going on with your child.
Right. I think, again, making your expectations known and making what I don't want to think of drug testing as a consequence, but for lack of a better word, we'll call it that. If there are suspicions or you're finding evidence, right? I mean, these disposable vapes, they're everywhere, and so they may have it in their backpack. I mean, if you shake out some of these kids' backpacks, you're going to find vapes for sure. At least they come in little cartons or, you're going to find something. Again, I think you have to be really straightforward with your child and let them know that how serious it is, how serious a nicotine addiction is, how serious a marijuana addiction is, what those do to your body, what those two drugs do to your body, and let them know that because of the seriousness of those two drugs, we may have to have you do a drug test. And, it's a simple, urine test. It's not blood test or anything, but, again, not every parent agrees, but me personally, it was more important to me to know the truth. And so that I can help you with this and what can we do to, if we need some, tobacco cessation, like what do we need? Than you being mad at me. Right.
Right. And then keep having to hide it. And so you mentioned that parents need to really educate themselves on vaping, on the products. What are some ways that they can find out this information?
Yeah. I mean, obviously this, podcasts like this, programs that we Weller have done in the community are great. Your school is a great resource. Again, I've mentioned it's a big problem in the schools, so they do want to do community events for it. I have mentioned before that I think LVHN should do a community symposium on vaping, just open it to the whole community so that it's a great way to get all of that accurate information. See, that's always the key, right? We can all go to the internet and do a search, but you never know, is this being sponsored by, a tobacco company or a vape company? It's hard. Point. It's hard sometimes. They're very, very good at hiding it, right? So you have to, sources matter.
Sure.
But just, educating yourself, ask questions, and just keep talking to your kids and finding out. If you keep those lines of communication open, they're going to say, you're going to find some things out, if the friends are vaping, who's doing this, who's doing that. It's tough because it is easy to hide. I mean, they do it in the classroom because so this was always interesting when I first found this out. So the aerosol is much heavier than smoke. So if you're here and you're smoking and I'm here and I'm vaping and we blow out this cloud at the same time, the smoke is going to go everywhere. The vape is going to fall because it's heavy. Because in that vape cloud, there is, like we said, lots of chemicals, but there's also particles, very small particles of heavy metals.
Oh, no. So another complication of this.
Yes. And that actually, because they're so small, they kind of get embedded in the lung tissue and they cause a lot of irritation. And that's due to the fact that that atomizer, these are metal. So, the heating of it and, turning it into aerosol comes, it results in these heavy metals. So anyway, so the vape cloud will fall. So, I mean, now the schools are getting a little bit more savvy about it, but the kids would just have their hoodies on and they could, you have it in your sleeve so you can just, vape it and then you blow it straight down your hoodie. And,
oh my gosh.
Right. So you can smell it though. That's the thing is I can smell it. I can be in a car and somebody in front of me I'm like, I can smell that a mile away. So the teachers, but at some point the whole school smells like, it's right. So that's why the schools installed those monitors, which I think have been pretty helpful.
So, I mean, clearly this is really prevalent in our area. What do you do if you find out that your child has been vaping? Either you discover it or they're sent home from school, suspended, in trouble at school because of vaping. What do you recommend?
Yeah. So the schools all have pretty, strict policies on vaping. And there is usually, every school's different, but they, at some point after like maybe first, second offense, I don't know. Like I said, they're all different. There will be a suspension attached to that. And I know I've been working with schools who there are kids who are missing, like suspended quite a bit.
Right. And then because of this.
So they're actually looking at some type of program like cessation program to use like in lieu of suspension. And so those same programs, parents can use those. Great. So the American Lung Association has some really, really good ones that parents can use. There are others, but I know I'm more familiar with the American Lung Association ones. Definitely, there's lots of different cessation resources, but nicotine addiction is tough, and it is
Right.
very hard for the kids to kind of break that addiction, especially because there's a behavioral modification, like there's a behavioral component to that. So you also need that behavioral modification, and definitely talk to their pediatrician, see what they can recommend in terms of resources for behavior modification. And it's just there are lots of resources, like I said, online with the American Lung Association and some of the others. But there can be consequences that the parents are going to put forward as well in terms of punishments and stuff. And obviously that's up to the parent, but yeah, it's a challenge.
And everything I'm hearing you say says how important it is to take this seriously
Right.
as a parent. You might be worried about drugs, you might be worried about alcohol and cigarettes, but this is just as important to keep on your radar, even though it seems to be safe and it's clearly not.
Yeah, definitely. And in addition to that is the vaping of THC. So marijuana is not legal here in Pennsylvania, and in the states where it is legal, you have to be 21. So none of these kids, should be using marijuana in any way. But the rate of use is up, and it's even up in younger kids, because vaping it's just so much easier than, back in the day, you smoked it. That was really like the only way you could do it, right? Now it just is so much easier, and it seems less dangerous in some way. It just doesn't seem like as big a deal, because you can just take this little purple or pink or juicy fruit or whatever, and take a hit off that, and that doesn't seem as big a deal as, I have a joint here with, I actually have to smoke it, right?
It doesn't seem sinister.
Exactly.
Yeah.
And it's not the same thing as smoking. If you don't smoke and you inhaled smoke, you're going to cough and cough and cough. That does not happen with the vape.
Oh, so it's easier for them to use it as well. It's not as, even though it damages their lungs, when they're vaping, it's not as harsh.
Right. It's different. It's definitely different. And the thing with the vaping THC is it is way more concentrated.
Right.
There's something that the kids, they call it dabbing. And that is when they use, it's actually a wax. It's a highly concentrated THC wax that they put in the vape. And that is incredibly dangerous.
So that gets melted in the same way.
Pretty much, yeah.
Wow.
Yeah. And so the level of THC that you're getting just off one puff of this is incredibly high, and for anybody who's never done that before, it can be dangerous.
Yeah. So it sounds like as parents, we've got to be hyper aware, not afraid to have the conversation. And how young do you recommend having that conversation? When do you start talking about vaping?
So that's interesting, because when we started doing this program, I believe it was the 2018-2019 school year is when we started. We started in high school. Made sense to us. Then shortly after, we're like, the schools are like, can we do it in middle school? We're like, sure. This year we did it for third grade.
Wow. So clearly this is part of your whole family conversation on an ongoing basis with every other
it's
safety issue that you're discussing.
Absolutely. Because when everybody likes to compare it to cigarettes, right? And there are so many differences, and not in a good way, because the vape, because of how it's packaged, because you don't have to light it, because you're not inhaling smoke, it's just easier, and it just doesn't seem as big a deal, and they're going to do it younger, and that's what the schools are seeing. So we take our we get all of our information from the schools, right? We don't just, maybe we'll do this. We go to the schools and what is going on, what do you need from Weller to supplement your curriculums, and so they tell us, they're like, we need vaping in the elementary school now.
Wow.
Yeah.
And it sounds like this is in every school.
Everywhere.
This is not anything related to
Nope.
socioeconomic status. This is every school, every
Mhm.
grade, big problem.
Yep. It really, really is.
Why are kids turning to vaping?
So I think kids are the same as they ever were. I think that, again, it's something that is maybe grown up to them. It's something that they see in social media. They see, again, back to the marketing. I can't stress that enough because it is such a huge, huge part of it. They use different social media influencers that they respect or they follow. We model for our kids, parents, many parents vape. So they're going to see it there. And they want to try it. They're curious. Their friends are doing it and they don't want to be left out. Again, kids are the same as they've always been. So they just want to do the grown-up things. And the big issue though is, when you're doing something that can, like vaping, which contains nicotine and you get addicted to nicotine, now, statistically, when they talk to, high school students, the majority of them say they do want to quit vaping. But now that they're addicted to nicotine, it's not so easy.
Hard,
yeah.
Right.
Yeah.
Let's talk a little bit more about the effects of vaping on your brain, on your heart, on your lungs. It's not just the vapor itself, it's the chemicals that are in it.
Right. So like I mentioned before, we're not going to know. We're not going to know the true long-term effects until we have a long-term, right? So when the teens now are, 40, I guess we'll really know for a fact of, all of the outcomes. But for now, we know enough about the, the effects of the, that vapor and the different chemicals on the lung tissue and how it can exacerbate already existing conditions like asthma. I know during the COVID pandemic, vaping numbers went down amongst teens, but that's just because they weren't together in school. So that was kind of interesting.
Right.
But now they just went right back up to where they had been. But that made, the COVID virus so much worse for people who were vaping and smoking, but still your lungs are so compromised, because of those chemicals and that hot, aerosol that you're breathing in. And now nicotine, we know the effects of nicotine, right? Of nicotine addiction, on the brain and, how that looks. So now that's something I actually didn't mention that I should have when parents are trying to, keep an eye on their kid, is to look for those signs of addiction. And
what would those be?
So, signs of addiction in anybody, but definitely in teens, irritability. They're going to have your highs and your lows. You can get jittery, headaches, nausea, and these are all kind of like when I can't have my nicotine, right? And so if you're in school all day, you can't have your nicotine, right? So you have a lot of headaches, a lot of, like I said, the irritability, the moodiness. And then some kids will say, oh, but my mom or whoever, when they're talking, they say that it relaxes them. And so I try to explain that, well, not yes and no, but, the fact that they're tense to begin with is because they are needing their nicotine. So once they get the nicotine in their bloodstream, they feel relaxed. So the kids are always like, oh, okay. Like it makes sense to them.
It does.
But before we explain that to them, they were under the impression that this makes my mom relax. This is relaxing.
So they saw it as a way to get relaxed themselves.
Right. But they don't realize that that's not really how it's working.
Yeah. Well, Kristen, thank you so much. You are a wealth of information on vaping. What would be some of your last pieces of advice that you'd like to leave with our audience?
Yeah, no, I think that this podcast is just an awesome opportunity to get that information out there about vaping to parents and, folks in schools as well, anybody who's working with children. And, my message to parents is just, really be open with your kids and keep that conversation going. Educate yourself. That is really the key to all things, right? When we are talking about keeping our kids safe. But, vaping is new to us. They know more than we do.
Right.
So we have to make sure that we're on the same page and that we're, again, just keeping those conversations going. And don't be afraid to ask those hard questions and, do what you need to do to keep them safe. If that might be drug testing or searching backpacks, then that might be what you have to do.
Well, thank you so
You're
much.
welcome.
We really appreciate you being here.
Thank you.
For more kid-focused health tips, advice, and must-know news about Lehigh Valley Riley Children's Hospital, follow us on Facebook and Instagram at LVHN Children. To learn more information about school-based programs offered by Weller Health Education, go to lvhn.org/Weller. And remember, every parent needs a partner through parenthood, so make sure to subscribe or follow Because They're Kids wherever you get your podcasts so you never miss an episode.